Hi, let's talk about non-surgical blepharoplasty. Now, this non-surgical blepharoplasty or a non-surgical eyelid lift can be suitable options for many individuals who are seeking and addressing concerns around the eyes. So, here are some factors that may indicate that you are the suitable candidate. Someone who has a mild to moderate skin laxity. If you have a significant excess skin, a surgical approach might be just an appropriate option for you. Someone who has good overall health conditions are the candidates for almost any cosmetic procedures, so including the non-surgical blepharoplasty, and that should be generally in a good health. Someone who has a realistic expectation, it's very crucial to have a realistic expectations about the outcomes of non-surgical procedures. While these treatments can produce some noticeable improvements, they may not achieve the same level of results as to equal to that of surgical options. Individuals who are having certain medical conditions such as any severe autoimmune disorders, infections, these might be contraindicated, and your healthcare provider will evaluate your medical history whether you are the suitable candidate or no. The other most important thing is commitment to the maintenance. All these procedures, which are non-surgical procedures, often require maintenance to sustain results. If you're considering a non-surgical bleph, you should be willing to undergo periodic touch-up treatments as recommended by your doctor. Consultation is very crucial, and it has to be with a professional. The best way to determine the suitability of this procedure is through the consultation with a qualified professional or the doctor. Now, they will assess you specifically and also assess your concern, evaluate your skin conditions, discuss more about your goals, and that is to determine if you are a proper candidate or no. So, how long does the non-surgical bleph last? The longevity or the results from the non-surgical blepharoplasty, also known as the non-surgical eyelid lift surgery. Now, this depends upon several factors. Now, the number one is the type of the product used, the response of the individual to the treatment, lifestyle factors, etc. Now, on an average, results from a non-surgical bleph can last somewhere between 6 months to a year. Keeping in mind individual response to cosmetic procedures, that can vary. Now, these are depending upon metabolism, lifestyle choices, and many more factors. Now, that which helps you with the health, and that can also influence during the result. So, let's talk about the recovery time of the blepharoplasty or also the eyelid correction surgery. This procedure depends upon person to person and also several factors, including the extent of the surgery, individual healing characteristics. Here are some general guidelines so that you can understand. The first initial recovery is 1 to 2 weeks. You can expect some definitive swelling for sure, a little bit of bruising maybe, and discomfort. Your eyes may be a little sensitive to the light, and you may also experience a little bit of tearing. Now, most people take about like a week off from the work so that they can resume back to the regular activity on initial recovery period. The bruising and the swelling are quite common after the procedure. Cold compression will always help you, and your head up elevated position will always help you while sleeping. That is to basically minimize the effects of swelling. Now, when do we resume back to the normal activities? While you may be able to return back to work and some normal activities after a week or two, it's very essential that you do not do much of a strenuous exercise. After few weeks, you're allowed to do the strenuous exercise after the proper healing. Your surgeon will definitely provide you a post-op care instruction. Now, this is to optimize the healing and reduce the risk of the complication. It's very important to note that the individual experience with recovery can vary from person to person. The factors such as age, overall health, adherence to post-op care instruction, and specific technique that is used for the surgery can always influence the recovery process. So, always follow your surgeon's advice for the smoother recovery. Attend your follow-up appointments, recommended communicate if there are any concerns or any kind of unusual symptoms that you encounter. Contact your clinic or the hospital promptly. Additionally, to avoid sun exposure, always use the protection from the eyes and irritants during your recovery period to promote optimal healing.